Hi, and Pierce. This is Dr. Jones checking in. I just remembered I need another post-it. This is A&P 1 Lecture Test 3 video 12 on page 13, apparently. 12 Noteset, page 13, and we're in chapter 9, and we did that page. Talking about synovial joints now. Novial joints in the body. We're not talking about joints otherwise. Except to say that smoking is bad for you. Bad for your lungs. Don't do it. Okay, so synovial joints. I'm in the way. There we go. All right. Synovial joints are freely movable, and they're classified as diarthroses. Do we do this cis versus cs? Diarthrosis, singular, and diarthroses is plural. One, just like parentheses to parentheses, because punctuation comes in pairs. Capital letter, a period. 2 commas, 2 dashes, parentheses. 1 parenthesis. I can't draw 1 parenthesis because that's just weird. They come in pairs. All right, so we have a 2-layered joint capsule. And the joint capsule is also called the articular capsule, aka also known as. The articular capsule has an outer fibrous capsule and an inner synovial membrane. So an outer fibrous layer and an inner cellular layer. It's almost like we've heard that before. Like maybe the perichondrium, periosteum, and now the synovial membrane, or the synovial, actually the joint capsule or articular capsule will include both. And there's the puppy. There you go, baby. Yeah. Some dogs have like so much, you can see so much of their expressions in their faces where, you know, like you throw them a ball, you always see the pictures on the internet, you throw them a ball and they get this like happy look on their face. And like my dog has so much fluff everywhere that you can't see her facial expressions at all. So it's all with my dog's all about the ears. Like you ask her, like I've been teaching her words, which I don't want to say now, like, but like rub, like pet, like pee pee, outside, you know. And like if her ears go up, then that means yes. But if they stay down, she's not interested. So that and the tail. So the only way we can figure out what the dog wants is by watching the ears and the tail. I don't know. Okay. It's quarantine time. We talk about our pets now. It's a thing. Apparently. Okay, so perichondrium has an outer fibrous layer and an intercellular layer. The periosteum has an outer fibrous layer and an intercellular layer. The joint capsule, aka articular capsule, has an outer fibrous layer and an intercellular layer. What you need to know about the intercellular layer, the synovial membrane, is that it makes the synovial fluid. There you go. Synovial membrane makes the synovial fluid, which is in this space. There's not air inside the bones here. The medullary cavity, they show them empty, but they're all filled with red marrow. Red marrow. Or yellow marrow. What are the only holes in the bones with air in them? The sinuses, that's right. Red marrow or yellow marrow. No air. They show it with the marrow dissected out, which is confusing because there's not air in the bone marrow. Have we talked about where you find air in the body? There are very few places in the body that you find air. So you find air in nasal cavities, left and right. You find air in the oral cavity, in the pharynx, which is the back of the throat. The pharynx connects to the respiratory tract, the lungs. That's all filled with air, which is as it should be. And then the digestive tract, which is the tube going from the mouth to the anus, that can have air in it, usually comes out with, you know, noises and smells. Okay. One up? One up, baby? Okay. No, they're secondary to the dog, sorry. There we go. That's a girl. That's a girl. Okay, so air in the digestive tract, which comes out, makes itself known. And that's it. There are dissolved gases in the bloodstream, but there are not ever bubbles of air. Bubbles of air in the bloodstream can actually kill you. So that's bad. And there's not air inside the bone. The only way to get air in the marrow cavity is an open fracture where the bone has broken through the surface of the skin and is touching air. That's the only way to get air in the marrow cavities. I guess you could inject it with air, but why would you do that? You get a great shot of the epiphyseal lines here. I guess they're drawn in, but anyway. I'm completely off topic. Okay. All right, so let's talk about these articular cartilages now. The articular cartilages, different from other hyaline cartilages. I think we have a slide for this. Oh, yeah, we do. Okay, that works. They differ from other hyaline cartilages. They have no perichondrium. They have more water, and the surfaces are slick and smooth. These are meant to move across each other freely. What separates articular cartilages in a healthy joint? The synovial fluid. These should not touch. There should be enough synovial fluid in here that they're cushioned from each other. And the synovial fluid, no, that's next. So how does articular cartilage respond to damage? Not well. If this is fractured, broken, irritated, the cartilage replaces damage with a rough connective tissue patch, which will scratch the facing articular cartilage, which repairs with a rough connective tissue patch, which will scratch the facing cartilage. And these two cartilages and their damage will wear each other down over time. You know anybody whose knees are bone on bone? That's what has happened, is that these articular cartilages have worn each other completely down over time, and with continued repetitive damage done by the healing process, because the rough connective tissue patch scratches that soft cartilage. So the best thing for it is to get new knees. Everyone I've known that got their knees replaced says they should have done it like 5 years before. And just when you can't stand it anymore, you go and get new knees. And that's how that works. Okay, so the synovial fluid is a layer of viscous solution with the consistency of egg yolk. So that's a friendly thought, egg yolk. And the three primary functions: lubrication to reduce friction, basically to keep these articular cartilages from touching each other. And also nutrient distribution. Cartilage, as you may recall, is avascular. So the synovial membrane that makes this synovial fluid puts enough nutrition in it to feed all of this cartilage on the ends of both of the bones that make up that joint. And of course, the shock absorption. The menisci, next slide. There we go. This is generally a picture on the test. Okay, so the menisci are made of fibrocartilage, so one meniscus, two menisci, like one nucleus, two nuclei. And this is a fibrocartilage pad in a synovial joint. So here's the other meniscus. And are the fat pads inside or outside of the joint cavity? Well, here's the synovial membrane, so they are outside of the joint cavity. And what fills in the changing spaces created as the joints move? That'll be the fat pads. So we've got tendons here. Here's the patella, the joint capsule with synovial membrane, the joint cavity with synovial fluid. We've got articular cartilages, and I want you to see this bursa here, the prepatellar bursa. And then here are a couple of other bursas. And then you've got some ligaments inside the knee joint, outside the knee joint. There's your patellar ligament. Okay. No, that was the end of that page. Okay. We will talk about ligaments in the next video. This has been A&P 1, lecture test 3, video 12 on page 13, and we talked about synovial joints. So the next one will be video 13 on Noteset page 14, and we will talk about tendons and bursae. Thank you, as always, for tuning in. This has been, we're going to have that conversation. All right, Dr. J out.